That we are live. Oh, here we are. We are live on Facebook. Welcome everyone to our town hall on healthcare in South Carolina. This is hosted by the Beaufort County Democratic Party. Thank you all for joining us tonight. My name is Jodie Srutek. I'm a candidate for Beaufort County Council in District 7, and I will be your host and moderator this evening for our town hall. I am thrilled to welcome three outstanding candidates to our forum this evening. Each of our candidates has a professional background related to a different aspect of healthcare, and we are excited to hear their perspectives and expertise tonight. So if you're joining us live on social media this evening, please do take a moment and share this with your contacts, and you can do so by clicking on the share button down below or by starting a watch party. So let's go ahead and we will just jump right in and meet our candidates tonight. We can start with Barbara Nash, who's running for South Carolina House District 124. Welcome, Barbara. Why don't you introduce yourself, please?
Thank you, Jodie. Yes, Jodie says, my name is Barb Nash, and I am the candidate for House District 124, which includes a number of places. If you're not familiar with what's in that district, it includes the city of Beaufort, Ladies Island, Data Island, part of St. Helena Island, Port Royal, Mossy Oaks, Paris Island, and part of Burton. So that is the makeup of the district. I am an advanced practice registered nurse, and I am a nursing educator at USCB. So thank you.
Wonderful, thank you so much. And then next we also have Chris deVries, who is running for South Carolina House District 123. Welcome, Chris.
Thanks, Jodie. I am running for South Carolina House Legislature, and which represents, my district is 123, which represents most of Hilton Head Island and all of Defusky. And I'm running because I think our islands need the representation that really reflects the needs and concerns of our population. We are currently in a time of crisis. I think most people would agree, and we need leaders that understand how to achieve outcomes that include repairing our economy, which we will have a session on in a couple of weeks, strengthening our access to quality healthcare and protecting our environment, as well as ensuring equality for all people. Hilton Head and Defusky deserve to have a voice in the state legislature that will proactively advocate for their interests and concerns of all their residents. Throughout my career, I've worked in management positions in the nonprofit sector. I focused on developing public policy initiatives addressing healthcare disparities and women's equality issues. And I've spent my life bringing together diverse groups to craft real life solutions. I'm very excited tonight to talk about one of my passions, accessing healthcare and increasing access to healthcare for everyone.
Wonderful, thank you, Chris. Thanks for joining us. And then finally, we have Mitch Siegel, who's running for House District 118. Welcome, Mitch.
Good evening, Jodie. As Jodie stated, my name is Mitch Siegel. I'm running for District 118, which is the southern half of Bluffton, from Bluffton Parkway south to the May River, running all the way up into Jasper County, including most of Hardyville and the Levy community. So if you're driving on the way to Savannah and you're going up to the bridge, you are in my district. Like Chris and Barb, I have a background in healthcare. The last 15 years of my career before retiring, I spent as a healthcare consultant for several different consulting firms around the country. And I spent some time early in my career working for Romney Care, the predecessor of the Affordable Care Act. And I got to see firsthand what increasing healthcare options for a community could do for a state. I'm running because for the last 17 years, this state has had single party access at the state house. We have a state legislature, which is Republican, both houses. We have a governorship, which is Republican. And we see where we are. We're in the bottom for healthcare. We're in the bottom for education. Our infrastructure is falling apart. And as the president so often likes to say, what have you got to lose? So I'm going to say, what have you got to lose by voting them out and voting Democratic? So I am here and running because, like Chris, I believe that people need an option, they need a choice, and I'm here to provide that.
Thanks, Mitch. So now we've introduced all of our candidates here. We are going to start in with some questions. So we're going to go to each candidate individually and kind of dive into some of their experience. So we'll start with Barb. Barb, as a nurse, and you're the only person on the panel tonight who has experience delivering direct patient care. So we'll start with you, and I have two questions. As an experienced healthcare provider, what have you found to be some of the biggest barriers to healthcare access?
Thank you, Jodie. I am going to address access to healthcare, but I want to make sure that folks understand that I have had a very unusual career. I was the first nurse in the state of Ohio to go into independent private practice and open my doors and provide primary care directly to consumers. So I have a perspective on what those barriers were and many of those barriers that still exist. I also want to remind our audience that even though the title of our discussion tonight is about healthcare, the United States doesn't really have a healthcare system. We have a sickness care system. The entire system is set up on the premise that you are going to get sick. It is no health promotion, disease prevention, except in a few minor areas. And so there is a great deal to lose by pharmaceutical companies, by large hospital systems, by sickness care providers if we were to suddenly become a healthy nation. But healthcare is something that everybody needs at some time in their life. And it is something that everybody wants, but not everyone has access to. Just like Willy Wonka and the Chocolate Factory, you have to have a golden ticket. You have to have a golden ticket to get into the system. And that golden ticket is either a private insurance carrier or it's Medicare or Medicaid. Prior to COVID-19, approximately 13% of South Carolinians were uninsured, so they didn't even have a ticket. I want you to think about what this COVID-19 has done in terms of employment, and if your insurance was connected to your employment, you have lost your golden ticket. And the state has turned down the expansion of Medicaid, which I'm sure we're going to talk about more later. But we have a number of people who are uninsured, who are also experiencing threats. We are experiencing threats to the Affordable Health Care Act. So it's not getting better. I want you to think about the first thing that happens when you call a facility or a provider and ask for an appointment. What's the first thing they say? It's not what's the problem. It is, who's your insurance carrier? Who do you have insurance with? So definitely that is a big barrier for people to get past that if they don't have that golden ticket. One thing that many people don't think about is health literacy. Health literacy is knowing your family history, what kinds of predisposing genetic makeup you may have, what you may be at risk for. It's being able to understand your own personal history. I am amazed at how many people I have provided primary care for who have said, no, I've never had any surgeries. And then I find a surgical scar on their body. But health literacy, understanding your own health, understanding your family's health, understanding your body, when understanding what could be wrong, and what point do you go and seek care? And once you have sought care, understanding what your diagnosis is, understanding what the treatment plan is. There is a lot of studies out there that show that the adherence to a medical plan of care runs about 5% of people really follow a medical plan of care. And it's probably, there's a lot of reasons that go into that, but one of them is, here is what's wrong with you, and here's what you need to do, and here's your prescription, and go on. We also, if you happen to have that golden ticket, we have a lack of primary care providers in South Carolina. Even along the coast here, we have a lack of primary care providers. So you may have a golden ticket, but you might not be able to find a provider to give you the care that you want. There are also barriers to advanced practice nurses, nurse practitioners. There is legislation that needs to be put in place that would allow them to practice to the full scope of their abilities. And as you move inland, the ability to find a primary care provider and get to someone becomes less and less. So maybe we could provide some incentives for nurse practitioners. Will help pay your educational loan debt. Yeah, if you'll go practice in a rural community. Most people take more time to select a new car than they do to select a primary care provider or someone to provide them care of any kind. And many times access is denied because of your insurance. You can only go to who your insurance will cover. So you may have a golden ticket, but you can only go to these places. And it may be that they don't have the money for a copay. That denies care, even if you have the golden ticket, don't have the money for the copay. Lack of transportation plays a big part. I can't get there, so therefore I'm not going. And something for many women can identify with, and that is lack of childcare, so that they can go somewhere to get care and not have to take their children with them. We also have a lack of specialists in the area. There's only one rheumatologist in all of Beaufort County. I know because I had to find him. But so lack of specialists is denying access to care. And I just want people to keep in mind the sickness care system. The #1 cause of bankruptcy in the United States is medical bills. So that's why people think long and hard. And I think about these people that have been in the hospital for weeks and weeks and weeks with COVID, and the hundreds of thousands of dollars of bills that they leave with. I'm sure they're going to be crippled with debt for a long time. Thank you.
Yes, thank you, Barb. I know a lot of those things that you mentioned really resonated with me, and I'm sure that they resonated with our viewers as well. You know, so many of the things you mentioned, I think I know personally, or I have experienced myself. So thank you for that. And so the next question I have is, it's a little bit more personal. So as individuals, we have opinions about our healthcare experiences, of course, but can you tell us what factors impact the quality of care for consumers?
Well, there are a lot of things that go into quality of care. Now, I'm not talking about the individual occasional time where you have an interaction and you come away feeling really good about what just happened to you right there. It is a whole constellation of things that go into impacting the quality of healthcare. South Carolina on the scoreboard, and it's a long scoreboard that I have studied, and it measures in a variety of different areas, ranks 45 out of 50 states in terms of all these different measures related to healthcare. And one of the things that makes us so low is our maternal child mortality rate. We lose too many moms and babies in this state. It has improved a little bit, but there's a long ways to go. And we have such a huge population of children living in poverty, which also brings down our rating. Again, you must have that golden ticket to access care, but the type of insurance impacts the quality of the care that you have. So if your golden ticket is a Cadillac, you're going to get the best care you can possibly get. If your golden ticket is Medicaid, you will find that there is a difference, a gap in terms of quality, because not everyone will accept Medicaid patients. The Medicare model is a very good model in terms of quality and in terms of efficiency and cost, but there are also some problems with that. But most places will accept the Medicare golden ticket. So it might be that the quality of the care is connected to the insurance you have. And certainly if you don't have insurance, then you don't have any care and you have to seek out free clinics. Where you live can greatly impact the quality of the care that you get. Certainly in large cities, especially in places that have teaching hospitals, you can find that you may get quality care, high quality care. There are 10 counties in South Carolina that have no hospitals. So that is a big problem in terms of quality. And you may find that the quality of your care, this is not a may, this is you will find, study after study has proven this, that the quality of your care depends on your gender and the color of your skin. So at the top, if you're a white male, you get a higher quality of healthcare. A white female next, and people of color come lower on the scale in terms of quality. And I have here an article, it's from the New York Times, Sunday, August 16th, that talks about racism's hidden toll and about in America, how long you live depends on the color of your skin. And it talks about the profoundly embedded structural factors in the healthcare system that impact the quality of the care you get. So it's not just genetic, it is embedded in the system. The racism and the outcomes are embedded in the system and have been there a long time. Hospitals do have some quality controls in terms of most states, except in Ohio, you have to get a license for your hospital. There's also a thing called the Joint Commission that gives its accreditation and blessings to hospitals. And there are some nursing measures that affect quality, but there are many things that impact quality. Lack of nurses. In patient setting, lack of nurses. There's only 42,000 nurses in the state, and we are lined up to be number 4 in this country for the nursing shortage. And it also depends on the educational level of the nurses. You will find that the more 4-year bachelor prepared nurses you have in your facility, the lower your morbidity and mortality rate. And if you go to master's prepared nurses in your facility, then it's even a better outcome. And so I know we have some robust 2-year nursing programs around. Yes, that's wonderful. And I encourage those nurses to go on and get a bachelor's degree because it does have an impact on the quality of the care. Staffing patterns affect the quality. We used to have 3 8-hour shifts. Now we have 2 12-hour shifts. After 8 hours, you're tired and you're not making good decisions. Not just nurses, but the entire medical staff. Medical mistakes is the number 3 cause of death in the United States. There's also this thing called the Press-Ganey score. I don't know if consumers are aware of it, but it rates your care somewhat like you would rate your hotel stay or your visit to Disneyland. And you cannot compare it. And it has to do with patient satisfaction. And many of the things we do to, for, or with patients in the hospital are not pleasant. So they are not going to have a satisfying experience. And then there's also something called productivity that is required and can impact quality. And the thing that really is evident is that when you go for care, whether it be an inpatient or outpatient, you need to take an advocate with you. The outcome of that visit or the outcome of that stay is different if you have someone there advocating for you. So in conclusion, we said South Carolina ranks number 45 and the US, the United States, ranks last in the measure of healthcare access and quality, indicating higher rates of amenable mortality than their peer countries. So that means comparing United States mortality in healthcare to their peer countries, Western European countries, ranks at the bottom in deaths that could have been prevented. So we have a ways to go. I don't want to be all gloom and doom about the healthcare system, but I want people to go into it with their eyes wide open, and that we have so much room for improvement and things that we can do to make it better.
Thank you, Barb. Thank you. I know your experience really, is very helpful in a lot of the things you talked about. I know I've experienced myself. So having an advocate is one, and being an advocate for others in the healthcare setting is really important. So thank you for that. And we're going to pivot now to Chris. Chris deVries, running for House District 123. If you're just joining us on Facebook, we're having a healthcare town hall discussion tonight with 3 of our local candidates. If you are watching, please feel free to share this with your friends and neighbors so we get the information out to all the voters here in Beaufort County about our great candidates. So Chris, your background's a little bit different. You have more policy experience. So why don't you tell us a little bit, you've worked on healthcare policy issues at the federal level. What do you think South Carolina can do to increase access to healthcare?
Well, thanks, Jody. And I just want to say I'm privileged to be on the ballot with our other 2 candidates tonight, as well as yourself. And I've also had the privilege of working with the best nurses in this nation for many, many years. And so a shout out to all my friends who are nurses who are watching. But I have worked on federal health policy for over 35 years. And I would have to say, although creating policies to increase access to healthcare is not simple, it is certainly necessary. We're talking about access, quality, and affordability of healthcare, many of the things that Barb was just talking about, and it's certainly an issue that impacts all of our families in our state. As we face the challenges of COVID-19 here, the cracks in our system became very transparent. The vulnerability of our nursing home residents, the lack of affordable health services, certainly the shortage of primary care providers, as Barb talked about, the fragileness of our health insurance. We had many people who lost their jobs. In Beaufort County, we have a very high percentage of people employed in the hospitality industry. And when we shut down, those people lost their jobs, and in many cases, they also lost their health insurance. And I think probably one of the most transparent things that came about it because of the pandemic was the showing of our public health infrastructure here in our state and how badly it was in need of resources. And I'm going to start a little bit and talk about our public health infrastructure. Our state, South Carolina, has been gutting the funding of our state health agency for over a decade. In fact, in a number of times they borrowed money from that system and actually never repaid it. And so those cuts in public health have left the people in our state with little access to care. The situation is especially critical in rural areas where healthcare employee shortages and hospital closures have made a bad situation worse. But then the pandemic hit, and we were ill-equipped to handle the situation, which was truthfully made worse by mismanagement of our governor. We were one of the last states to shelter in place. We were one of the first states to lift the order to shelter in place, which resulted in South Carolina and certainly Beaufort County as we became nationally known as a hotspot. So in order to curb COVID-19 virus, we need to do contact tracing. We need to understand where people have been exposed and who is vulnerable And we still do not have the systems in place today to accomplish that. Our state policymakers, our folks in the state legislature need to prioritize funding for public health in our state, not only to address the impact of COVID-19, but also preventive and chronic health conditions. And so I'd like to move and secondly, talk about the prevention for just a moment. Prevention is one of those clear-cut cases that has a tremendous cost saving. If you prevent chronic diseases in the first place, you save a lot of money in the long run. But as we have noted in other instances tonight, we rank in the bottom 10 of all the states in the country for diabetes, mental distress, premature deaths, and infectious diseases. All health outcomes that in fact can be addressed with preventive measures. We need to make sure people have access to preventive screenings. We need to make sure that people have education on healthy lifestyles. And we need to empower our communities to perform health assessments of their residents. And the number one reason that people don't seek preventive health in this country and in this state and in this county is because they lack health insurance. I'd like to shift gears just a little because in Beaufort County, we have a disproportionately high population of elderly. And we want to talk about ensuring the safety of those who live in assisted living or in nursing homes. As the coronavirus ripped through our community, one fact became very clear. Those who lived in nursing homes or assisted living facilities were not only more at risk for catching the virus, but they were also more likely to die. And unfortunately, we had a number of deaths here in Beaufort County, many of them in nursing homes. Nursing home residents, in fact, in the state, made up 1/3 of the lives claimed by the coronavirus. Our policymakers, again, they must do everything in their legislative power to ensure that our nursing homes are utilizing best practices, that they have the resources they need to ensure safety of the residents. And so when you make that very difficult decision to move a family member into an assisted living or a nursing home, it's not one that also carries an increased risk of being infected with COVID-19. Talking about a disproportionate number of older adults, they also have unique healthcare needs. I was fortunate in one of my jobs to serve as the CEO of an organization that focused on geriatric mental health care. I worked there for 14 years. And I was able to observe firsthand the benefits of specially trained health providers to increasing the quality of life of older adults, including their families and their caregivers. For example, my mother suffered a stroke. She actually ended up suffering 8 strokes over the last years of her life. But after her first stroke, she couldn't sleep. After she recovered from the stroke, she had gotten her mobility back for the most part, but she was having a terrible time sleeping. And she went to a number of providers and they started giving her sleeping pills, which really wasn't working. And finally, it was a geriatric mental health provider who found out and diagnosed her with post-stroke depression, which is actually very common. And one of the first, unlike depression in middle age and younger adults, depression in older adults, often the symptom is disturbed sleep habits. And so they were able to treat the depression, which then treated her sleeping, which overall increased her quality of life. She was able to get medication and her quality of life improved significantly. But yet here, and as Barb again pointed out, here in Beaufort County, we have no geriatric behavioral health units in our whole community. The closest one is in Charleston, which is 2 hours away. So that brings me kind of back full circle and talk about Medicaid and the decision for South Carolina not to expand Medicaid when the Affordable Care Act was adopted by Congress. And the impact of that decision, the state legislature's decision not to expand Medicaid, has resulted in tens of thousands of poor adults in South Carolina. And here in Beaufort County, we see that up close. 15% of our population has no health insurance at all, and that was pre-COVID. And many more have very inadequate health insurance. We are actually, as a county in South Carolina, we are relatively rich in resources compared to a lot of other places. And yet Beaufort County has the highest percentage of uninsured children in the entire state. So as a policymaker, I would fight to expand Medicaid and insure hundreds of thousands of South Carolinians who need that care. It actually would cost us very little. We are already sending our federal tax dollars for expanded Medicare and say New Jersey or Virginia, who've already passed Medicaid expansion. So I think it's time we do the same and bring those tax dollars back home.
Yes, thank you. And thank you for sharing that personal story about your mother. I know sometimes it's hard to do and talk about our, our personal experiences and family members, but it really does resonate with people and help them understand, our background and how we've come to our experience. So, noticing that three of us here tonight are women, three of the four panelists tonight are women. I know you specifically have worked on a lot of policy issues that are specific to women's health. So can you tell us about how South Carolina is doing in meeting the needs of women's healthcare needs?
Well, thanks, Jodie. Yeah, I have to say, it's some of the work I am most proud of within the healthcare realm, within the mental health realm. I always wanted to see how women were impacted and what the needs of women were from a policy perspective. Some of the things that I was involved with that I am very proud to this day is ensuring that those benefits paid for by health insurance include those services needed by women, ensuring that diseases that disproportionately impact women were funded and got the research funding that they deserved, and ensuring that women are included in our scientific clinical trials so that our scientifically based treatments are appropriate for both genders. But despite that, women still do face a lot of unfair and discriminatory insurance practices. Women are still denied coverage. Women still pay more for health insurance than men. And women's health needs certainly still need to be addressed in South Carolina, as Barb pointed out, especially for women of color. For example, Black mothers who are more than 4 times likely to die in childbirth than white mothers. As we noted, a lot of South Carolina counties have no hospitals. 11 of South Carolina's 46 counties have no OBGYN, no access to reproductive health care. Again, looking at the insurance side of it, almost 15% of women of reproductive age in South Carolina are uninsured, which is much higher than the national average of just over 11%. What people might not know is prior to the Affordable Care Act that was passed by Congress, there was not one single individual market plan in South Carolina that covered maternity care. But similarly to pre-existing conditions where the Affordable Care Act made it illegal to deny insurance for someone because of pre-existing conditions, the Affordable Care Act also made it illegal to not include maternity care in individual market plans. So you take away the Affordable Care Act, as many of our policymakers are talking about, you also remove the requirement that individual plans need to cover maternity care. But there have been some recent legislative successes. I have to say, we have some good advocates here in South Carolina, some good organizations, and they have pushed for the passage of some legislation, or at least partial passage. I would like to make note of the Pregnancy Accommodation Act, which was actually passed by the legislature in 2018, and it was actually signed into law by the governor. And it requires employers to provide reasonable accommodations to employees for medical needs that arise from pregnancy, childbirth, or other related conditions. So that was a win. The South Carolina House also passed a bill, actually not once, but twice, that would decrease unplanned, unwanted pregnancies by allowing women to have access to more than 1 month of birth control at a time. So it's well known, the research shows us, if women have access to birth control, easily access, that it reduces by huge numbers, actually, unwanted or unplanned pregnancies. I will make a side note here to say my opponent in this race voted against all 3 of those measures, all 3 times, restricting women's access to care, including access to birth control. So I have to say, throughout my career, I really have fought to ensure that women can make their own healthcare decisions. I want to stand up for the attacks on women and accessing the care they need. Right now, as we've noted, less than 16% of the members of the State House are women. And some of those men, not all, some of the men are great, but some of those men are making dangerous decisions about our healthcare and that really needs to stop. And so that's really why I'm running for office in this very important election.
Thank you, Chris. That's such an important point you made. I don't think we can drive that one home enough. But let's turn our attention to one of the good guys. Hey there, Mitch. We're glad to have you here as well on the panel. And so I know that your experience is a little bit different from the other candidates because your experience is in the administrative side of healthcare. So I just have a couple questions for you. If you would like to talk about how did Massachusetts achieve quality improvements in healthcare delivery and consumption after delivering what's known as Romney Care in 2006, their healthcare plan in Massachusetts. How did that go?
Sure. In 2006, when Massachusetts rolled out Romney Care, I was working at that time for Parkland Hospital in Dallas. And my staff looked at me and said, "What is wrong with you people up in Massachusetts that you actually think that healthcare is a right?" These people couldn't get past the idea that we wanted to make sure that everybody had access to healthcare, that everybody could access it. They were of the opinion that, well, if you don't have healthcare, you go to your local church for that. And I just found that mortifying, to say the least. This is something that has to happen to everybody. But what we did in Massachusetts is that we made the premiums for healthcare so low and made it possible for everybody to have it, and actually instituted the original individual mandate. By the time we got done with that, before folding into the Affordable Care Act, Massachusetts had 98% of eligible citizens covered under health care. But there was a great cost to that. It did bust the budget, but what it didn't take into account, and what people forget, is that all of the charitable care that was being given out by hospitals was now no longer occurring. People were in fact covered and were able to get health care. What it meant was that we had to look at different ways of viewing healthcare. And we have to, as Barb said earlier, you have that golden ticket, you have healthcare, you have insurance. But we need to get past the idea that healthcare is about insurance. Healthcare to me is about having the correct number and mix of providers, whether it's doctors, nurses, advanced practice nurses, technicians, therapists, whatever. They need to be able to treat and take care of populations in a community. We have to do better in attracting these providers to South Carolina. We need to ensure that reimbursement schedules to our providers are sufficient to attract them here and to keep them here afterwards. Healthcare should not be just about, illness. We need to have sufficient facilities to treat patients, like those 10 counties that don't have hospitals. That's almost unconscionable. We have to make sure that we have doctors' offices, clinics, nursing homes, assisted living centers, doc-in-the-box clinics that are easily located near to those people who need them. Healthcare is also about teaching people how to use healthcare, what type to use, and when to use it. One of the things we ran up against in Massachusetts was, wonderful, you now have health insurance. And what did people who didn't have it do? They would go to the emergency room for a sore throat. So now we had to teach them that the best way to handle that is to go to a CVS clinic, a Walgreens clinic, something of that nature that's more appropriate, and save going to an emergency room for the times when you really need it. That lowered cost to everybody in the area. So we really need to make sure that people have access to medications when they need it at prices they can afford. Healthcare should not be about having pharmacy benefit management companies, changing medications on patients based upon the deals that they've made with the drug manufacturers, as opposed to what's in the patient's best interest. I had an instance 3 years ago where, out of nowhere, my insurance company decided to change my diabetes medications, not because they checked with my endocrinologist, but because they were no longer getting the type of reimbursement and kickback from the insurance, from the drug manufacturer. So they changed my medications. When my medications were not working, the new medications, I spent almost 6 months fighting with them to get me back onto the original medications, which had been working. When we finally did get me back onto the medications, it was open enrollment for the next year, only to find out that lo and behold, the medication that I had been on the prior year that I couldn't get this year was now back on formulary again next year. So we need healthcare to take care of our patients. We need it not to be about what reimbursement the pharmacy benefit managers are getting, but what's in the best interest of the patients. So I think that, if South Carolina were to follow the path of Massachusetts in really pushing to ensure that we have access to healthcare and that we actually have the right types of providers here, we can actually be a leader in healthcare, not just a follower. And I also want to end this particular question with the fact that my opponent, Mr. Herb Kurzman, when the federal government offered up, Medicaid matching dollars to the states, Mr. Herb Kurzman was a sponsor of the bill to forbid South Carolina from accepting that money and from expanding Medicaid. So he bears direct responsibility for the deplorable state of healthcare in South Carolina.
Well, thank you for that, Mitch. I know we're nearing toward the end of our time, and the second question, actually, you just touched on it a little bit, because that was my next question to you. I know that the other candidates mentioned the Medicaid expansion, so I was going to ask you about that. How can South Carolina benefit from the expansion of Medicaid to cover more people, both unemployed and the underemployed?
Right, as everybody, as both Barb and Chris have stated, at this point in time with COVID, so many of our population are about one paycheck away from losing their health care. And if people didn't have to worry about holding on to their health care and keeping a job that they don't like, that they don't enjoy, that is underemploying them, they could actually be looking for jobs that pay living wages, that have chance for advancement, that can give them the opportunity to make a better life for themselves, which would then raise tax revenues back to the state. So I think that is really critical. And Barb touched on something earlier about the fact that, nurses are probably the highest rate of medical bankruptcy, because they work so darn hard taking care of patients, especially nurses in nursing facilities, whether it's a hospital or nursing home, picking up patients, moving them, lifting them. Most nurses are not full-time employees of their facilities. They're per diem, or they're contracted by the day or the week. So they work long and hard. They wind up getting hurt on the job, and they wind up losing their access to their health care, whatever they had, and they then have incredible bills. So, to us, it's really important that everybody has the option to be able to take advantage of a state-funded, state-run Medicaid program, so that they're free to then go off and look for those jobs that will pay them a living wage and will return tax dollars back to the state.
All right, thank you. Thank you for that. So it's about 6:45. So we want to start wrapping this up. Thank you again to our viewers who stayed with us so long tonight. I know, this is a topic that touches every person's life, all of us included. So I appreciate you all watching this evening, and to the Beaufort County Democratic Party for hosting us tonight. Just very quickly, I want to give all the candidates an opportunity to make a brief closing statement, about 2 minutes, and just tell us where folks can go to find out more about your campaign and the other platforms and issues that you're focused on. Where can they learn more about you? Barb, why don't you go first, and and then you can pass it off to Chris, and Chris pass it off to Mitch, so everybody gets a chance to give a little statement. Thanks.
Thank you, Jodie. And I want to echo what Chris said. It's an honor to be running with all of you. I may be a first-time candidate for office, for public office, but I am no stranger to the legislature. In Ohio, I was president of the Ohio Nurses Association, and in that role, I represented close to 190,000 nurses. Not all of them belong to the association, but I was the voice and I was the face at the State House representing those nurses in issues related to safety, to healthcare, to nursing practice, to patient protection. And it is amazing what legislators will do to tuck pieces of legislation, pieces inside legislation that impacts healthcare, that directly would impact my practice or the safety, harm and safety of patients. So we had to be a constant presence at the State House in order to monitor what was happening. I had to work with legislators on both sides of the aisle. I was involved in writing legislation that impacted advanced practice nursing. And that leads me to another issue, that we do have folks who can provide primary care and do it safely and effectively. And that is advanced practice nurses. And there is an effort around the country by different medical groups to keep advanced practice nurses from practicing to the fullest extent of their ability. There are a lot of folks who are champions of allowing advanced practice nurses to provide direct primary care without all of those constraints. And that is a whole workforce that we could tap into to bring these services to the folks of South Carolina. So I thank you for giving me this opportunity. I am running because I think I have the ability to create change, and we need to have someone with this expertise in the State House. Thanks.
Thanks, Barb. I'm going to take it over. And thank you for your remarks. I would just say that I believe access to healthcare is a complex issue that requires a very wide array of solutions. And I think our legislators in Columbia have not lived up to their responsibility in this way. When I'm elected, I will work to expand Medicaid coverage for all who cannot afford health insurance, as well as strengthen access to health services for children and the elderly. I will sponsor measures to increase the availability of especially health services as well as primary care through incentive programs such as loan forgiveness. I am right there with Barb. I worked on ensuring that advanced practice nurses could get directly reimbursed from Medicare when I was working for the American Nurses Association. And I will continue that work and ensure that South Carolina has access to advanced practice registered nurses by ensuring that they have full practice authority here in the state. And I plan also to work on funding some innovative models of care, looking at the expansion of telehealth, because that is an area that we can reach some of the more rural areas. So I have worked most of my adult life for nonprofit associations, working to expand affordable and quality care for everyone. I promise to continue that mission when I am elected to represent Hilton Head and deFusky. To find out more about me, please go to my webpage, Chris deVries for SC123.com. And thank you everyone tonight. And now, Mitch, it's yours.
Thank you, Chris. I want to say that I cannot be more pleased to be running on a ticket that includes Chris, Barb, Jodie, Nathan, and our other Democrats. This is an exciting time for me in my life. I never thought I'd be running for office, never, ever crossed my mind. But I realized a few years ago that when you have legislators who don't listen to their constituents, who hold them in contempt, they need to go. They need to be held accountable. So with that, you can learn more about me and my campaign at my website, Mitch, the number 4, SC, the number 118, as in the House District, Mitch for SC 118. And in closing, I just want to say that right now, South Carolina is far from being a leader. I'm not even sure you can call us a follower. We're more a laggard pulling up the rear. But we need to show some courage and do the hard work. And we need to do the heavy lifting required if we're going to change things in South Carolina. But this is not going to happen if we continue to play the game of, oh my God, we need to have the absolute lowest tax base that you can conceivably have in the country. You know, right now, for individuals, we pay ridiculously low tax rates. We also, for homeowners, you know, our property taxes are quite low. Our corporations pay nothing. So if corporations, homeowners, and individuals are not paying taxes, the state has no money. And our legislature and our governor have spent way too much of their time trying to ensure that taxes are as low as they can possibly be. And when they do have money left over, you know, they sit there and they say, maybe we need to hold on to it for a rainy day. If we're not going to give it back, let's hold on to it for a rainy day. Well, I don't know about you, but not only is it raining and pouring, it's monsoon season out there. It is a rainy day, and we need to spend that money and make sure that we spend it wisely and ensure that people have the ability to take care of themselves, to stay healthy, so that they don't need to utilize the healthcare system as much as we do currently. So with that, I would just ask you again, go to Mitch for the number 4, sc118.com for more information. Thank you.
Thanks again to everyone. Thank you to the Beaufort County Democratic Party for hosting our forum tonight so we could give these candidates an opportunity to talk about their expertise and their issues. And we also want to thank those of you who were watching tonight. We really appreciate you taking the time to be an informed voter and educate yourselves about the candidates that we have. So thank you again, everyone, and have a wonderful night.